Okay, so what I'm going to have you do is just start from this side over here, introduce you, just give me your first name and who, yes, and who you are with.
I'm Beth, and my partner, my husband, is Roger.
And where are you from?
We're from Harrow, Ontario.
Harrow, very good. Young lady?
And I'm Barb, also from Harrow, Ontario, and here with my husband, Paul.
Okay, so Barb, let's start with you. Since two of you had care, but I want everybody to just participate and tell what happened with you, but also, you know, the husbands, the spouses can also just share also what you've noticed as well. So go ahead and tell us what happened. What kind of problems were you having when you came in? What was going on with your life?
My life wasn't so good at that point, really. Actually, my life, I'm 60 years old. All of my major joints are pretty well full of osteoarthritis. So I was scheduled for a knee scope that actually would have been taking place tomorrow, actually. I needed a knee replacement, but was told too young. Couldn't move my shoulder and my neck because of the arthritis in my shoulder. My lower back, I wasn't able to bend. So I didn't really like the options because I've had really bad history of some not so favorable foot surgeries. So was a little nervous to even comprehend knee surgery, and really was faced with thinking I'd go from knee to knee to hip to hand and be the bionic woman and still have arthritis pain. So was interested to try a healthy new alternative.
So when you say you were interested in trying this, though, what was your thought on this? Like you saw the talk, you came to the talk. What were you thinking?
I saw the talk, and I think I was to a point in my life, and the amount of pain I was in needed to be hopeful, but have to admit I was very apprehensive, thinking it was too good to be true. Really didn't think my life could get better without medical intervention.
Drugs. Drugs.
I mean, I had tried all of that. I'd done
Tried the drugs?
I'd done the physio, and I was on, medication, and I have a slight kidney disease as well, of which I'm actually very excited to find out if that will also benefit that. So I'm pretty excited to follow that path as well.
So what were the problems you were having in your daily life as a result of this? What were things you couldn't do? I
couldn't really walk anymore. I used to walk, we have to pick our mail up at a post office. I used to walk pretty regularly. It was never an issue for me to do a 5K walk or to do a 2K for sure. It was never an issue. I had gotten to the point that I couldn't do that without pushing probably the stroller of our grandkids. And even at that, our last little, we do some charity walkathons, and I couldn't even do that, even pushing the stroller with the pain. I couldn't go really up and down stairs. Getting up and down, I couldn't get into, I was to a point with the arthritis in my shoulder as well as my knees, I couldn't get in and out of a bathtub. I now am here 5 weeks later and am getting in and out of a bathtub. I'm going up and down stairs.
What about your even outlook on life?
Oh, my outlook on life is just second to none. Like, I really was to a point that I'm thinking, okay, well, I want everybody to know I'm happy with my life. I've had a great life. And I'm okay. And here I am. Thrilled to be alive. Before, I was like,
feeling good. Yeah, you were satisfied. You were satisfied you had lived a good life, and that you were satisfied that good life was basically behind you. And now you're after me. Where are we going next on a trip?
yeah.
Yeah, there you go.
So it doesn't stop with the cost of the stem cells. It's going to continue. Because now you've got a more positive outlook on life.
I now feel like there's life again.
Is there anything that you've been doing lately that you were kind of surprised that you're able to do?
Well, actually, last week got down on the floor for the first time. And played
Scrubbing
with
or playing?
No,
Playing or scrubbing?
We haven't got to scrub the floors yet.
Played with our grandchild for the first time.
Wow, that's amazing. Roger, why don't you tell me what's going on with you? What kind of, what
Okay,
was
my
it?
name's Roger. I'm 75 years old. Very active lifestyle. I was a deep sea diver, cyclist. I've been blown up twice in my military career. It ended up I've had 4 knee replacements, elbow operated on, ankle operated on, shoulder problems. I heard about the seminar, and I says, oh, another black magic voodoo thing, you know. I says, who believes in that?
Snake oil.
So my wife went to it, and she says, guess what, you're gonna take it. I says, I don't have that much money, I'm broke. She says, well, you're gonna take it anyway, so. Lo and behold, I come in here, met a nice Dr. Roy, he's a good joker. I don't know if he's Polish enough, but that's beside the point. But anyways, I had the injections, and 2 weeks later, well, first off, the injuries I had, my knees, cramps, always cramps from the nerves. I could never have a full night's sleep. 3-4 times a night I wake up standing up to straighten my legs because of cramps. My shoulder pain, always. Headache sometimes. But anyways, I had the injections. 2 weeks later, I woke up all night. I can't tell anybody because nobody will believe me, especially my wife, because she knows I'm waking her up all the time. And it was amazing. I slept all night. I said, no, this still didn't believe it. I said, this is all hokum pokum. I said, it just must be the oxy I'm on or something. Because I was on Oxycontin for 8 years with this pain. So you either do the drugs and sit in a chair and you lose your life. I lost 8 years of my life. Don't remember anything about it. So anyways, the next day, a couple days later, my elbow wasn't cracking. There was no pain. And I said, now we gotta look into this. This is working. Something's going wrong here. I'm feeling much better. I can put my leg up and put my socks on. I don't have to get on, pull everything up by a machine. I said, this is incredible. And yesterday I was out shoveling snow. And I haven't done that for over 12, 13 years. So, I think I'm only about 39 years old now instead of 75. And I got facial hair growing all over the place, so I don't know if that has something to do with it, but it's like Paul, my friend here, says, if your car breaks, you fix it. And this old truck is getting fixed, and I'm feeling no back pain. That's another thing. No back pain.
The sciatic nerve.
Sciatica nerve is not hurting anymore, and this is amazing because I can walk without panting like a racehorse.
When he used to walk, they actually sent him to a lung specialist because they thought there was something wrong with his lungs because he was panting all the time, which was being caused by the pain of the muscles and the back. So since then, he is not panting anymore. Wow. He doesn't go when he does, like he can get out of the chair. Actually, when he stands up, he's actually standing straight. He's not hunched over. He went shopping the other day, and he used the cart, but he was only using it in case something hurt. And he wasn't leaned over it. He was standing up. So.
Well, even this morning, we picked him up, and the first time I picked him up, and the entire time I've known you, he comes out of the house with his cane. Like, I said, Roger, where's your cane? Oh, I don't need it.
Actually, I have a walker upstairs, I have a walker downstairs, and I have an outside walker.
You don't use
that
them.
I used to walk around. And now I keep forgetting where I put them because I don't use them. So, I wish I had this 10 years ago, this treatment, and I wouldn't have to have those 4 knee replacements, because that is absolutely agony. If you're gonna have a knee replacement, think again, because
This is
to get one done 3 times, every year and a half, it's absolutely terrible. Worse than a Japanese concentration camp. I shouldn't have said that.
Should. But, I mean, like we were telling the fellow in the lobby, like the fellow in the lobby, I mean, he just had his injections and he's curious as to what to expect. And so he's asking Roger and Barb what's going on. I'm Paul, by the way, I belong to Barb. And the way that I put it was, it's a gamble. But if I had this kind of luck, if I could have this kind of luck at a casino, I'd go every day. Because the gamble has definitely paid off. And from the I mean, you can hear it from the patient's perspective, but from the observer's perspective, I was the one that was skeptical. I wanted Barb to get on a treadmill before we took the injections, and because I didn't want this subjective analysis afterwards as to whether she had improved or not. I wanted something I could, put my hands around. I'm the outside observer. I can tell you, Roger's not using his cane. Barb is not using her medication. I mean, this is a lady that had been gotten to a point that, I had to help you with your socks. When your thumb was acting up, I would have to cut your meat. And now, I'm older than her. I'm hoping that she starts returning the favor at some point in time. I don't know, but
You're lucky.
yeah.
Well, when we came for the initial consultation, I remember actually sitting in these same chairs, and we were joking, as we typically always joke, and Roger saying he wanted to feel 49 or 39, and I said, I will be happy if I just can feel 60, my age. I said, because I was feeling 90. I said, I have a 91-year-old mother who could outrace me. I said, I just would like to feel 60. And now I'm probably
Getting close.
feeling, I say for sure I'm feeling 60, because I feel like I could do anything right now, and it's a nice feeling.
All right. Well, thank you very much. I appreciate all that. And
Thank you.
anything else
Just
you want to add?
amazing. That's all I can say. Just amazing.
I'm just glad he's not the janitor. You come in on January the 1st, there's nobody else here but him. And you hear about all these scams, and I'm thinking, okay, he's the janitor, the real doctor's off on holiday, and he's just taking the office, and he's got the people coming in, and hey, I'll charge you for a consultation, I'll sit you down, it's a nice office, but nobody else is here, does it seem real?
Sorry, Roy, we didn't mean to.
But I mean, but Barb, you had the whole treatment checked out with your.
I did.
your nephew?
I spoke with my family doctor. I didn't want to do anything new, and I mean, we totally trust our family doctor at home, and I didn't want to suddenly be doing anything unusual and strange without his approval, his knowledge, and he said, go for it. He said, he's as intrigued as Dr. Picard is with trying to see how far it will go, because I did have a little bit injected through intravenous, so we don't know where it will go, as I was told. It will go where it's needed, and maybe that will have been to my thumb that I didn't have done that is feeling better, but maybe it will go to my kidney, and that will be a huge miracle.
Takes the wrinkles away.
So we don't know. So I'm just intrigued and excited to see still where it's to go, because it's still early.
But I have to say, but for a friend of Barb's, you look at Barb, her eyes are much brighter than they were. It was almost like she was always cringing because she was in so much pain, but now she's like wide open.
Except for when she cries.
Except for when she cries, yeah.
I'm
But
not
she
supposed to-
cries easily.
I'm not supposed to go to store openings, so it's okay.
I haven't told my family doctor. I'm supposed to tell her next week. So now I'm going to tell her, I don't need you anymore, you're fired.
Well, Bart did that with the orthopedic surgeon. He basically put him totally on hold.
Yeah, because you were supposed to go today for this knee.
Tomorrow I was scheduled for a scope, so.
And according to your family doctor, he thinks the orthopedic surgeon would be excited about this whole thing. But he's encouraged her to actually tell him.
I
See,
did call him.
I think I've had 7 scopes in my life and 4 knee replacements. Now, that was over the last 10, 11 years. If I knew this then, I would have saved all that
Pain.
pain and time. And
Sure.
can I get money back on my walking equipment?
Well, listen, I want to
Sale.
thank all 4 of you for coming in. You took the time. How long of a drive was it to get here today?
About an hour and a half.
Hour and a half you came down here. It wasn't necessary. You chose to come down here. And I appreciate you saying the kind words, but it's the truth. And now you're helping other people because they're all thinking the same thing. Many people are going through the same issues, and it's nice that the four of you took the time to come down here, and thank you very much.
You have to believe it,
You're
thank you. You gotta believe it.